The BioPro Digital Compression Screw, the next generation in arthrodesis for correction of digital deformities. Over the years, new and improved surgical procedures have been developed for the correction of hammer toe deformities. Digital arthrodesis provides a permanent and predictable correction of these deformities. The next generation technology for arthrodesis of the lesser digits, for example toes 2, 3, and 4, is the BioPro Digital Compression Screw. The BioPro Digital Compression Screw affords the surgeon the ease of end-to-end arthrodesis with the stability and true compression afforded with screw fixation. The BioPro Digital Compression Screw is a 1.5 mm screw, available in varying sizes ranging from 20 to 55 mm in 5 mm increments. A 1.8 mm screw is available for backup. The screw is made out of stainless steel with several unique features. A very thin flat head eliminating the need to countersink. In addition, the head of the screw is cruciform with a central locking hole to reduce blade travel and assist in screw stabilization. The proximal shaft is not threaded, acting as a lag screw with an outer diameter of 0.45 inch, while the distal outer thread diameter is 0.62 inch. There is a 3 mm guide extension tip which cuts through the medullary canal and allows the screw to follow along a pre-drilled glide path. Each screw is packaged sterile with its own tracker device. The tracker provides easy insertion through the distal and intermediate phalanx. The unique screwdriver also acts as a measuring instrument. Screw sizes are laser etched onto the shaft of the driver. The screw retaining device helps to stabilize the screw during implantation. The incision of choice is made over the proximal interphalangeal joint. The tendon is exposed, cut transversely, and the proximal and distal slips are reflected to expose the articular surfaces. Cartilage is removed and the surfaces are inspected for proper alignment and position. A .045 K wire is used to drill the primary hole through the center of the intermediate phalanx, through the distal phalanx, and out the end of the toe. This is followed by the over-drilling of the previous hole using a .062 K wire. A .035 K wire is now used to place the glide hole through the center of the proximal phalanx. A small transverse incision is made at the end of the toe using the K-wire hole as a center point for the incision. All soft tissues are dissected from the end of the distal phalanx. As the toe is placed in the position for arthrodesis, the screwdriver, with its laser-etched screw sizes, is abutted against the end of the toe and rotated until the desired screw size is visualized. In this case, a 40 mm 1.5 digital compression screw was chosen, so as to allow some threads to remain in the joint. A stab flexor tenotomy was also performed to correct a distal interphalangeal joint positional deformity. Each screw comes with its own disposable tracker. The tracker is inserted into the center of the intermediate phalanx and pushed out the end of the toe. The guide extension point of the digital compression screw is placed into the tracker, and with slight screw tracker counter pressure, the tracker is retrograded as the digital compression screw is inserted through the distal and intermediate phalanx by hand until the guide extension point is visualized. At this time, the point of the screw is placed into the previously drilled glide hole in the center of the proximal phalanx, and the screwdriver is now used to complete the arthrodesis, making sure not to over-tighten the screw. Visualization of the arthrodesis is made during simulated weight bearing. A C-arm may be used before closure to identify screw placement, proper bone-to-bone contact, and to provide hard copy documentation for the chart. Imaging shows proper placement of the digital compression screw along with excellent bone-to-bone contact. Redundant tendon may be removed prior to repair, followed by skin closure. Standard dressings are applied, along with an approved post-operative surgical shoe. The BioPro digital compression screw is not designed to remain in the digit after successful arthrodesis is achieved. The BioPro digital compression screw is a non-permanent fixative device which normally should be removed in 6 to 8 weeks. During the post-operative course, the patient must remain in an approved post-operative surgical shoe. This allows for minimal range of motion and movement of the digits. The BioPro digital compression screw may be removed in a hospital or approved surgery center, but most commonly, removal is performed as an office procedure. The digits are blocked locally, followed by a small incision at the distal tip of the digit. Soft tissue is scraped from the screw head, and the screw is removed using the screwdriver. One suture is used for closure, and the normal post-operative protocol is followed. The BioPro digital compression screw, the next generation in arthrodesis for correction of digital deformities. Benefits of the BioPro digital compression screw. Number 1. Minimal reduction in toe shortening. Number 2. No external fixation devices, thereby eliminating pin tract infections. Number 3. The ability to fuse the PIPJ, DIPJ, or both. Number 4. Cost-effective compared to other implant devices. Number 5. Easy to use. Number 6. The absence of a permanent implant. Number 7. Patients may bathe after suture removal with the psychological advantage of having no pins or wires exiting the skin. Number 8. Simple in-office procedure for screw removal.